Meanwhile, nursing unions say they want the government to provide them with counselling facilities as the country braces itself for a third wave. Nursing unions are reported to have said the second wave had a devastating effect on the healthcare workers, and many had to resign as a result of the trauma of dealing with a high number of deaths. A total of 339 healthcare workers died of COVID-19 related illnesses in South Africa between March and November last year, with most deaths occurring in the Eastern Cape, KwaZulu-Natal and Gauteng. Sicina is a nurse and General Secretary of the Young Nurses Indaba Trade Union, who joins us now. Thank you so much for speaking to us. So we've just been hearing from the other side. Talk to us about healthcare workers and what you've been facing. What has been the worst of it? Staff shortages, have they impacted on you and your colleagues?
Thank you for having us, Sister Piso. Like we always say as young nurses in our trade union, to say our public healthcare system has never been ready. We were never ready for any pandemic because we've been failing our people under normal circumstances. We were complaining before the pandemic. We were complaining and making noise about gross shortage of staff that leads to fatigue, disgruntlement, and people resigning and leaving institutions. This is what we are facing at the moment. I've spoken to 5 different hospitals, specifically to those nurses who are nursing patients in COVID-19 designated wards, to say, how is the situation? One particular professional nurse was saying, it's crazy, things are just getting out of hand. People are absenting themselves because they are overworked. They work like days on end. It's because of gross shortage of staff that there's nothing sometimes that the institutions or the institutions management, there's nothing they can do in terms of having more hands. That they just need to employ more nurses and more staff. So at the moment, we are worried, so when we are going to be hit by this third wave, to say what's going to happen if already it is not in full swing as yet. Things are not getting out of hand. We don't see patients laying in casualty in numbers so far. But what's going to happen should these admissions increase and we run out of beds and we have our departments like...
Mr. Sicina, is there a database of risk assessments? As you say, you've been speaking to colleagues and this is what they're reporting to you. Is there a database, district level, national level, that speaks to exactly what is happening to frontline workers, that talks about what the dangers are, these poor working conditions, insufficient PPE, for you as unions to have a clear idea of what your members are enduring?
Sister Piso, what we've been saying is that maybe one day we need to be given such a platform. We need to be given such a platform as nurses, more especially because I often say I'm the General Secretary of Young Nurses Indaba, but I'm a worker leader. Even now, I'm going to work doing night duty, so I'm doing bedside nursing. As a result, we need one day to be given such opportunities where as nurses we are going to talk about the impact of and this impact should be documented, the impact of gross shortage of staff, the impact of infrastructure and dilapidated healthcare facilities, and also the impact of lack of material resources. What does it do to us psychologically, mentally, and spiritually? What does it do to the system itself and to the community as well?
Okay, let's steal 3 minutes now. I know it's not enough, but let's try and steal 3 minutes now. Give us a picture, because we can only think about it from an academic perspective. Perhaps you can speak about your own experience, your own colleagues. What does it mean psychologically for you, for their families, for the communities that they're hoping to help?
The system itself is under siege. As a result of the system is under siege, community are under siege, and us as nurses, it's crazy, Sister P. So at some point I was making an example that there was a moment where I had to take a patient from my ward to ICU, Sister P. So, and unfortunately in ICU there was an empty space where we can intubate and put that particular patient and give that patient a second chance in life. But Sister P. So there was no nurse to nurse that particular patient. As a result, I had to turn back to my ward, a general ward, where that patient can be intubated. As a result, we watched the patient dying in front of us, and deep down we know we could have done a lot of good stuff to save that particular person. It doesn't happen. Those are cases that there are many of them that are not reported, and it affects us psychologically. So that is why we are disgruntled, we are demotivated sometimes. It's a matter of motivating yourself and tell your nurses to say, let's keep on keeping on. We are the last line of defense. We can't give up now. But it takes its toll on us. It even pushes us to remember that we are getting poverty level salaries. We even sometimes forget that this government, the relationship of our relationship with our employer is a toxic relationship.
And that's what I wanted to ask. What is the organizational response? They may complain about lack of resources, but do you feel heard? Do you feel like there's an effort to improve your situations?
There's nobody is listening to us because I remember at the beginning of this pandemic, young nurses in Indaba called, like we were not our demands were not ridiculous. We were saying add more nurses. Go to South African Nursing Council. Find out how many nurses are registered but are not employed. How many are sitting at home. Let's make sure we have all those ones. We need to, we were also saying, like, as a token of appreciation, because already we are complaining about COVID poverty level salaries, and we are also complaining about government imposing zero-wage increase. As a token of appreciation, give us 6 months income tax break, but nobody listens to it. This thing, that is why I believe, and we believe as YNITU, we need a platform where we are going to sit down and say we are killing the community. Nurses are demotivated, and we are tired of going to these healthcare facilities. The aim is to heal our people, but we are used by our government, that is our view, as accomplices of murder, because we go there, we know there is insufficient human resource and material resources, and sometimes these things are beyond our control. What then can you do? The community will continue being angry. The animosity and hatred between nurses and the community is not going to end anytime soon.
It's a sad thing to hear, but thank you for sharing that with us. And indeed, we should be giving nurses more time to share their personal accounts and experiences. Thank you so much for that, Richard Sicina, saying that nurses, healthcare workers are forced to work for days on end, and they are understaffed, and he says they feel they are being driven to watch people die as well. Richard Sicina is a nurse and general secretary of the Young Nurses Indaba Trade Union. Right, so let's take a look.